Hi, this is Peggy with Natural Awakenings Magazine, and I'm pleased today to be having a conversation about chiropractic care, gut health, structure, how it all ties together. And joining me today is Dr. Danny McLane of ADIO Chiropractic. He's the owner there, and Renee Barasch, the tummy whisperer of Digestive Health Solutions, and they're located in Libertyville, Illinois. So welcome. I'm so looking forward to our conversation today.
Thank you.
Thank you very much, Peggy.
So we'll start with you, Dr. Danny. Tell us a little bit about what you do at ADIO and your approach to chiropractic health and structure and performance of the body. And then we'll bring in Renee to figure out how digestion ties into all of this.
Sure, absolutely. So a lot of times people think about chiropractic and they think about neck pain, back pain, headaches, that kind of thing, if they think about chiropractic at all. Really, the reason why I got into chiropractic is for functional neurology. So when we have access to the nervous system that controls everything else, we can tap into the immune system. We can tap into the digestive system. We can look at psychological issues as a factor of either metabolic or genetic functions. And when we have the ability to look at the nervous system, we can correct for any kind of issues there. And then once that's corrected, if there is a problem that still persists, we can look to see a little bit deeper. A lot of times, when people are looking to solve a problem, they're looking at an input-based solution, right? They're looking at what they can put into their body to make it work. A lot of times, once somebody's had a chronic disease or a chronic illness or a problem for long enough, it doesn't matter what you put in because the body's not processing it correctly. Does that make sense?
Yes.
So one of the things that I explain to people very early on is that input times process equals output. So if you have batter and you put that batter in an oven, that should turn into cake, right? Unless your oven is broken, in which case it comes out as batter or it comes out as charcoal, right? Yeah. So, and that's one of the nice things about having a digestive therapist on staff with me is a lot of times they'll come and talk about their diet. So I'm eating this, I took this out, I went gluten-free, I started, dairy-free, vegan, all these, and that's fine. And some of those things are really good. The problem is if your digestive system isn't functioning the way that it should, and that could be because of a chemical issue or because of a nerve issue, right? And Renee's fantastic with the chemistry. I deal with the nerve side, right? So if you're putting all this good stuff into your body, are you respecting the 3 phases of nutrition, right? The 3 phases of nutrition are what goes from your plate into your mouth, what goes from your gut into your blood, what do you digest, right? What do you eat, what do you digest, and then what do you utilize? A lot of people don't look at, and there's not really a good way in standard medicine to look at what happens once those nutrients go into your bloodstream. There's a lot of times I work on people that have iron deficiencies or they have calcium deficiencies, they have osteoporosis, osteopenia. Obviously being a bone doctor, we look at a lot of that stuff. But if you look at vitamin B deficiency, that could be causing psychological problems or zinc causing immune problems. So once we start looking at what happens in the blood as a factor of allergies, autoimmunity, some of these more difficult cases to solve, anything that lasts more than 3 months is chronic. So at that point, it's something that falls within my territory to work on. And once we start really digging into those, what we're finding is it's not necessarily an input-based problem. It's a process-based problem. So sometimes they don't have the right raw materials to work with. They have bad batter, but sometimes it's their oven is broken. And most of the time, by the time people end up here, that's where we have to start, is working on the process. So I think that's major area of focus for me is really, are they doing the basic things correctly before we get into really fancy chemistry? Are we looking at the basics first, right? I have people come to me and they have a list of 15 medications they're on. I said, how well do you eat? What do you eat? And they're like, oh, well, let me tell you about that. I said, how about you tell Renee about that? Yeah. So then Renee takes a good amount of time and sits down and talks with people and gets them on a good eating plan. And a lot of times that really resolves it. And they don't need medication because healthy people don't need medication, right? But sometimes, even if they clean up their diet and even if they're doing everything right, they come back and say, okay, I'm doing all this stuff, but there's something else wrong. Yeah. So then I step in and I can go through and do a series of different tests, whether it's blood testing or hands-on testing, muscle response testing, applied kinesiology. I do a lot of electrophysiology. We have a couple other ways to check, but when we start to get the process part of it figured out, then those two things together, you get structure times function, and that's quality of life. And that right there is sort of how we operate in a nutshell at a very high level. We could always dig into some deeper details.
Right. Right. But the structure times function equal quality of life. I mean, that's the basics right
Right.
there. If you don't
Yeah,
have one, you don't have the other, you obviously your quality of life will be affected.
absolutely.
And I think sometimes, people probably come to you and say, but I've been eating all my healthy vegetables. I've been eating all my supplements. I've been taking everything else. And I know from speaking with Renee in the past, you're not always digesting it, or your body doesn't know what to do with it, or for some reason it's allergic to the
Sure.
thing that you think is healthy.
Well, here's an interesting tie-in, right? A lot of people have they have a lot of inflammation in their body.
Mhm.
All inflammation in the body is undigested proteins. So we talk about
Hmm.
digestion and proteins. Well, where do you start digesting your proteins? That's in your stomach. That's with enzymes. And now enzymes, go throughout the body. And Renee is amazing at that. She could talk about enzymes all day long, and I love it because she and I, no, seriously, she and I
Yeah.
totally geek out on enzymes. And what most people don't realize is by the time you're 40, your enzyme capacity is half of what it was when you were 20, and that's if there's no alcohol or ibuprofen or other things like that involved to diminish that supply. And that's if you're eating regular fresh fruits and vegetables, maybe a little fermented food here and there. Obviously, you got to keep your histamines low. But if you don't have good enzymes, that at a chemical level makes it harder to get energy from your food. So you're spending more energy to get less out. That's a downward spiral. And that's one of the reasons why Renee does so well getting people well. But that could look like a shoulder pain or a chronic knee problem. And maybe you don't need surgery. Maybe you just need to get your enzymes fixed. Um,
So Renee, how, for somebody who doesn't really understand enzymes and how they're helping, um, give us a quick overview.
Sure, for sure. So there's three different kinds of enzymes. You've got digestive enzymes found in the digestive tract. You've got your metabolic enzymes found throughout the body, which makes all your functions work.
Mhm.
And you've got your food enzymes, which are found in raw food. And those are the ones that people are deficient in. And typically all three for many reasons, because when the body's under any kind of stress, the enzymes plummet and they become deficient. So as we try to ask our bodies to start digesting food, like Dr. Danny said, we lose our digestive ability as we age. We don't have enough enzymes, and the enzymes that we have on board are being used for other things and not for digestion. The body's smart. It will rob Peter to pay Paul, and it will take the enzymes where it needs to and put it to where it needs to go. So you can steal enzymes to make your metabolic functions work, meaning your heart beating and your lungs and all your internal organs. So if you don't have enough digestive enzymes on board when you're eating food that isn't raw, which we don't fully recommend a raw diet, sometimes here and there, then you're just deficient from the get-go. And then when you're asking your body to digest food that doesn't have enzymes in it, you're just at a complete deficit. So that's why putting the enzymes in at mealtime is fabulous for digestion. And then we use metabolic enzymes in between meals to help with inflammation and detoxification.
So Dr. Danny, you're
sorry, I was just really enjoying that. That's fantastic.
he was zoning out on that. So somebody might come in, like you said, with a shoulder problem
Mhm.
and chronic inflammation, and it always hurts, and come in expecting maybe to have an adjustment. So what's the whole process? If you could walk us through, how do you determine what is gut related?
Sure. One of the things I always like to inform my patients of is your body wants to heal in a very specific pattern. And this is really the secret sauce, right? Like I'm giving you a peek behind the curtain. So step number one is always neurological, because nerves control everything, right? So it goes neurological, mechanical, chemical, behavioral. Those are the 4 steps. Now, behavior is more like, how do you sleep? How do you sit at your desk when you're working all day? What kind of pillows do you use? What's your couch like? How many hours do you spend in the car a day? There's a lot of those different components. But let me give you a quick story, right? Like just a hypothetical. So you go to a medical doctor and they say, hey, it hurts when I do this. They're like, oh, stop doing that.
Yeah.
That's a behavior change. That doesn't really fix the problem though, right? So maybe you have a good doctor and they look into it and they say, well, here's a medication. You can take this chemical to help get rid of this inflammation. It's inflammatory, we'll treat the inflammation. Well, first off, that's an exotic chemical that your body doesn't understand. So even if you are going to use chemistry-based medicine, and that really shouldn't be first line, you should use something more natural because your body knows what to do with it. But if we take a step deeper, that you're looking at the mechanical parts. Oh, well, that's like physical therapy and stretching and standard chiropractic where they crunch and twist and crack and pop. And I can still do all that. That's part of the process if people need that. That's also where massage comes in, or foam rolling, or yoga, or any of the other disciplines. They're all fantastic. They do a great job, but that's step 2.
Okay.
Step 1 is balance the nerves, right? So by testing specific nerves, and this is all done manually. We don't use big fancy equipment. It's not thousands of dollars. It's all as efficient as it can possibly be. I'll go through and test manually different nerve pathways and see which ones are working, which ones aren't. And by finding the ones that are not working, then we can determine which pathways are off. So for example, very, very common, somebody had a whiplash 10, 15, 20 years ago. What happens is their skull gets crooked. It pinches a nerve behind the base of the skull, the vagus nerve. That's the one that goes to the stomach to produce enough stomach acid. Classic story. That person doesn't have enough stomach acid. So when they eat, they don't have enough acid to break down their food. Maybe they're enzyme deficient because of other habits. Then what happens is because they don't have enough chemistry, their body tries to break it down mechanically. So the stomach squeezes and squeezes and they get regurgitation. Now they have acid in the wrong place. Their gastroenterologist says, you have too much acid. And they don't have too much acid. They have too little acid, but they have acid in the wrong place. So they give them an acid reducer. Now they're digesting worse.
Yeah.
And instead of digesting their food, they're fermenting it. You see, so part of it is clinical history. I want to know some of these details. But when you don't digest your food well, you get a cramp that happens in your right hip, and it causes a twisting of your pelvis. So there's a valve down there called the Ileocecal Valve. It's a digestive valve. When that valve cramps, it causes your body to try and move away from it. So the right hip rolls back and there's a little bit of a twist over that. But that also puts a tension at the base of your neck, right by the base of your shoulders, and at the top of your neck at C2, where things get stiff. So that's where people are always trying to twist, and or if you get adjusted, that only lasts about 48 hours, and then everything goes back out. It's because they didn't get the neurological piece. So what happens is we have to look at the systems of control to see what's working, what's not. And that's as specific as I can say without having a person right in front of me.
Right. But it's a great overview.
Right. And it happens so often. So many times people come in and they have a digestive issue. They don't necessarily complain about it, but they do have a degenerative disc at C5. If you look across the board, medical records show that L5 and C5 are the two areas in the spine that have the most common degenerative spine. Because
L5 is lumbar.
L5 is right down on top of the sacrum. So if you follow your pelvis, the top of your hips across to the mat, to the back where they meet, that's L4. The one down in the pocket is L5. So it turns out that not all spinal bones are created equal. Some of them act as an anchor point for the spinal cord that stretches from top to bottom. And if you have tension in there, your body will try to compress the spinal column to get tension out of the system. And by doing so, it will actually crush the disc, because your body puts everything on a priority basis. Your heart is number one priority. Your lungs are number two priority. Brain and spinal cord is number three. That means everything else is sacrificial to the preservation of the first three things. That means it'll move a bone out of place. It'll cause a muscle to cramp. It'll cause a disc to degenerate. It'll crush everything down, because if there's too much tension, the spinal cord loses about 70% of its function. Now, and that spinal cord function could be to an organ. It could be to your liver, your spleen, or it could be to muscles where you have weakness. A lot of times carpal tunnel or chronic knee pain or any kind of joint pain that was not caused by a direct trauma is caused from some kind of pinching or tension in the spinal system. So by evaluating which pathways are working, which ones aren't, we can follow that pathway. We can follow that stepwise procedure from neurological to mechanical to chemical to behavioral. And we can peel back the layers. And as we peel back one layer, we can see what else is next. Either people are completely done, or we go on to the next thing, and we handle it very systematically.
And so, Renee, when do you come in this process?
Well, I'm sometimes chicken and sometimes egg. Sometimes people come to me first with their obvious digestive issues. And so many times, I'm going to back up for a minute. My background, I'm trained by a chiropractor. All my digestive health therapy, I was trained by Loomis Institute of Enzyme Nutrition. Dr. Loomis is a second-generation chiropractor. So he taught us how to marry structure and function with the anatomy, physiology, and the chemistry, which is why Dr. Danny and I work so well together, because it's a perfect partnership. So for me, so many times I've been doing this for almost 16 years, and I was a licensed massage therapist for 20 years before that. So I've learned that part of it as well too, which is what makes it so much nicer for me. But I can tell if it's a chemistry issue, and I would say for everybody it is a chemistry issue, but for everybody for sure, it's an electrical issue too. So many times when I'm working with a patient, and we're changing the diet and putting in the right supplementation, they will see some sort of change by and large. Some people get a wonderful change right away. Some people it's a little bit slower, but I do some testing as well too, and I can see if there's any kind of pinching in the spine, in which case, boom, I got to send it to the circuit breaker guy. so we can
And
flip the circuits and help everything function better. I mean, the truth is everybody should receive chiropractic care anyway. It is preventative for everything, in my opinion. I've been around chiropractors for most of my career, and I think without it, it's hard to have the body heal in the way that we would like to. So they really are synergistically together. I'm lucky to be able to use the tool belt that I have, and I'm even luckier to have one of the greatest chiropractors, and I know many because I was trained by Dr. Loomis, and I have handfuls of them at my disposal at any time with Dr. Danny. He's just phenomenal, and very blessed to be able to be working with him. But yes, the structure, the function, the chemistry, they do work together. The body just doesn't have 1/3. You've got the whole triad of health, like Dr. Danny mentioned earlier. So it's a pairing, I would say.
great, great. And I would imagine in some cases, there's overlaps in the systems too. It's not just one system with the problem, it's 2, 3, or all of them.
Right.
Well,
Having those
right.
problems.
Like when there's a pinch in the spine, how is everything going to fire properly?
Yeah.
You can have all kinds of, from arrhythmias to skin issues to sleep issues, and we can put the good nutrition in and the good supplementation in, but if you don't fix that structure, boy, nothing's going to really work properly. So you really have to you're not going to build a house on top of with a really crappy foundation. And that's what chiropractic is to me. It's that good foundation so that the house can get built properly.
Well said. So, Dr. Dandy, do you have any tips for those watching us today?
Tips, like you're talking like at home stuff?
Could be some
general guidance.
Some general guidance, could be a couple of at home. It could be calling your phone number and scheduling an appointment.
Well, and here's the thing. I got to end this to help as many people as possible, right? So one thing I will say, if you feel like you're not getting the care that you need, if you feel like you're not getting better, if you feel like you're wasting a whole bunch of time and effort, I see people that have been to the Mayo Clinic, and the Mayo Clinic gives them a clean bill of health, and yet they're still very sick.
Yeah.
If nothing else, get a chance to come in and have a consultation. I do recommend that you talk with both Renee and I. There's a lot that we can offer, and the only way that you're going to know if what we have is right for you is if you come in and have us look through what you have. Case history, hands-on assessment, hands-on evaluation is always going to be the most thorough and the most detailed. If nothing else, you walk out with a better understanding of how you can get better. And if you want it to be easy, we are obviously the experts in this area. We solve some of the most difficult cases that there are. We get people better when other people can't, when other doctors fall short. And I would honestly say the best tip I can give you is ask the right questions. If you're only getting one answer for one particular issue, and maybe it doesn't fit, or maybe you've tried what they've offered you and you're not getting better, keep asking, be your own advocate, find somebody that can help you. One of my biggest frustrations is I've seen people that have seen 30 other doctors before they found me, and they ask me, like, well, why didn't anybody else do this stuff? I can't answer that question. I don't know. I will be honest with you. This is not just a job for me. This is my life's work. This is my passion. This is what I do. This is when we're done here, I'm going to go read more about what goes on with human physiology, because there's always more for me to learn. Yeah. And I recommend for anybody, if you get stuck and you want more answers, come chat with me. We'll figure it out.
Well, I like the one thing that you mentioned, especially of you may have had a car accident 10 years ago.
Yep.
And oh, that was forever ago.
Right.
But you haven't felt right since. Something's not, and the two of you working together, being able to help figure out, get to the root of it, as it were, and fix it.
One last bit of perspective I'll give you, and this ties into both what Renee and I do. All natural things are subject to natural laws. Human beings are subject to natural laws. And one of the natural laws is threshold. So things like water can get colder all the way until the point where it hits 32 degrees and it goes from liquid to solid. That's a transition threshold, right? So 32 degrees, it's solid, 33 degrees, it's liquid. Your body's the same way. Your liver does not show one symptom of anything until it's lost 80% of its function. Your heart is the same way. Your spleen is 90%. You could be 85% diabetic and never know. So by the time a symptom shows up, you're negotiating the last 20%. And that's the other trouble that people have is each of these systems balance each other out. Like you'd mentioned, it's more than just one system. So if you go to a gastroenterologist, or like a gut doctor, or people with chronic sinus problems, or people with bone pain or joint aches. Those doctors are going to look at their one system. With Renee and I, we look at all of the systems, how they intertwine, and how, so that way you don't get lost in the cracks. General medicine works for 70% of the population, but what if you're one of the 30% of the people that it doesn't work for and you fall between the cracks? You need somebody that can look at a bunch of different areas and put together the puzzle for you. And that's really what we do with all the things that we offer. And we've only just touched on the surface of what we have just in this time. It goes much, much deeper than that. And I'd say that if you have a need, make sure that you're asking questions to people that can give you a myriad of different answers that can help you work your way through your issues.
Renee, anything to add?
I think Dr. Danny said it all. One thing you said, Peggy, was somebody might have had a whiplash, a car accident, they haven't felt good since, and they keep searching and they keep searching, or they just kind of live with it. You don't have to live with your pain. You don't have to live with wondering why anything is happening in your body that shouldn't be. And if you're checking in with yourself and you're saying, I don't think that's right, reach out to us. Give us a call. We are here to answer your questions and give you the very best help that you can get. In a way that you can't really get from a medical doctor. And, I think there's a place for Western medicine. There absolutely is. We're the before Western medicine, or even the after, to try to get people feeling good, back into their lives, enjoying their lives, and not having their health be another job that they have to do. They should be enjoying their lives. It's been a tough thing through the whole COVID thing. Everybody's very different now. And I think people are more health conscious now, more so than ever, because they're fearful. But forget being fearful. Take action, ask questions. We're here to give you answers. We're on board and just ready to help. So please reach out.
So if folks do want to learn more or contact you, where
Sure.
do they go?
Yeah, ADIO Chiropractic. They can go to thetummywhisperer.com. They'll get both of us, either or. If they get Dr. Danny, they'll get me. And if they get me, they'll get Dr. Danny. So we're partners.
And you're located up in Libertyville.
Up in Libertyville, 316 Peterson Road in Libertyville. Mm-hmm.
Great. Well, thank you. This has been very, very informative. I've got my mental checklist going here already of But thank you so much. I look forward to some more conversations with you down the road where we can start digging deeper into some things as well.
Well, thank you very much, Peggy. I'm really glad to have the introduction.
Great. Thank you.
Thank you, Peggy.
Bye.
Bye-bye.